go through the basics of Ashmari in Ayurveda. Ashmari is considered as Maharogam. It is Ghoram.
थोड़ा तुमचा व्हिडिओ दाखवा ना. Please show your face.
It is actually, my video is on. I am doing through my mobile phone. That's why some technical difficulties are there. So after the presentation, I will switch on the video.
Okay, fine. Sorry, sir.
No problem, sir. Ashmari is considered as Maharoga. It is very Ghora, Daruna, and Vasti is considered as Marma, one of the Marmas. The formation of Ashmari is Yada Vayurmukam Vasteravartya Parishoshayan, Mutram Sapitham Sagavam Sachuplam Va Tadakramat, Sanjayade Ashmari Ghora, Pittat Goriva Rojana, Slashmasrecha Sarvaha Syat Ashmari. That means it's an accumulation. The stone is formed by the accumulation of the minerals and materials, kidney or in the bladder. The main thing is that all the Ashmaris are Slashmas, right? It's Kabajam. There is a importance of Kabham in Slashma in all types of Ashmari. So this is the Purva Lakshana of Ashmari. Athasya Purva Lakshanam. Vastyatmanam cha sarvada tadasana desheshu parido aviru mutracha basta gandhatam mutra krucham joro aruji. Lower abdominal distension, severe pain around the pelvis, smells like God's urine. That means a bad smell will be there, and gives you a difficulty in passing urine. There will be a systemic disorder of symptom like fever, anorexia, etc. These are the Purva Lakshana. It is from the Ashtanga Hridaya. Ashmari Lakshana. Samani Lingam Tuk Nabhi Sivani Vasti Murthasu Vishirnadharam Mutram Syataya Margarodhane Tat Vyabaye Sukham Mehe Dacham Gomeda Gopamam Tat Sankshobha Kshade Sasra Ayasa Cha Adiru Bhaveda. Pain is the common symptom in Ashmari. There is difficulty in passing urine. There will be sometimes there will be obstruction of urine, and sometimes it will be uninterrupted, and there will be change of color. There will be color change of urine. Sometimes it will be associated with hematuria and Sankshobha Kshadesa Asramayasa Chadirubhaved. Pain, there will be pain in the abdomen and pelvis on exertion. This is again from the Ashtanga Hridaya. This is the Ashmari Lakshanam from the Vaishyaji Ratnavali. Ado Shula Kukshideshe Katyusyada Paschad Rodho Jayade Mutramushnam. There will be pain in the Kukshideshe and abdomen and pelvis. Paschad Rodho Jayade. There will be obstruction after that, and the urine will be hot. Either Lingam Ashmari Roga Chinnam Kudyat Beshajade. If any person having these type of difficulties, you have to seek medical attention. This is the Ashmari Lakshanam from Rasaratna Samuchayam. Kadau Kukshi Pradeshe cha Shulam Prathamado Bhaveda Paschat Rodho Jalan Mutram Ashmari Roga Lakshanam. There will be pain around pelvis and abdomen, obstruction of urine, there is dysuria. These are the, in many texts, most of the symptoms are same. There will be pain, there will be difficulty in passing urine, sometimes there will be obstruction, and there will be sometimes hematuria also. First of all, we have to see that the Lakshanas that has been said in earlier textbooks are mainly related with the Vasti, that means urinary bladder. There is a quotation from Vaishyaji Ratnavali in Vrikaroga Adhyaya, in which if Ashmari happens in Vrika, what happens? Vrikyor Ashmari Yoga the Kadaji Fever Lakshanam. Mutram Shonadayuktam Sya Shaityam Cha Panipadayoho. So there will be pain, and there will be the Mutram will be in Shonida Yuktam. There will be hematuria, and there will be Shaityam Cha Panipadayoho. The cold texture of the extremities. And This is the Vadika Ashmari Lakshanam. Tatra Vada Drishatyartho Dandan Khaditi Vebade. This is from Ashtangridya. Murdranadi Mehan Napi Pedi Tension Konan. Sanila Munjati Shagrat Muhur Mehadi Bindusha. Shidalo Guru Syadva Ruksham Ashmari Chasya Syachida Kantakeriva. Pain is the main symptom. There will be dysuria and pain. There will be a severe pain in the abdomen and pelvis. This is a Paidika Ashmari Lakshanam from Ashtangatam. Pitena Dekhide Vasti, Pachimani Vushmo, Bhallada Gasti Samstana, Raktapida, Asida Ashmari. There will be dysuria and burning sensation of urine, and the urethra will be the main Lakshana in Paidika Ashmari. The size of the will be like Bhallada Gasti, like and the color will be Rakta Pida Asida Ashmari. Kabaja Ashmari is Vastir Nustyadeva Slashmano Shidalo Guru Ashmari Mahadis Lakshana Madhuvarna Adva Sida. The Ashmari will be very, very big in size. The stone will be very big in size. There will be pain, and there will be difference in the type of characteristics of the pain in each type of Ashmari. When we go to the treatment, then the basic principles of the treatment is Vastir Virego Vamanam Chalakhanam Sweda Avagaho Abija Vari Sejanam Vasti Viregam Vamanam Lankhanam Swedanam Avagaham Vari Segam, the Dhara. These are the basic principles of Ashmari. And there are many types of Ganam. Ganas are mentioned in our text, in which Ashmari are indicated, like Ushagadi Ganam, Varanadi Ganam, Veeradaradi Ganam. There are a lot of Ganas which are indicated in treatment of Ashmari. The Pathya of Ashmari is, this is from Vaishyaji Ratnavali, Kulatta Mudga Goduma Jirnashali Yavahida Dhanyu Amisham Yavashugam Pathya Ashmari Rogina. Again, another reference is there from Vaishyaji Ratnavali, Kulatha Mudga Godhuma Jirnashali Yavahida Dhanyu Amisham Ardragam Yavashugam Pathya Ashmari Rogina. Yeah. These are the apatya mentioned in Ashmari Chikitsa, like Mutrasya Shukrasya cha Vegam Amlam Vishtambi Rosham Guru cha Annaparam Viruddha Mannasanam Ashmarinam Vivarje Sadadam Apramatta. The holding of urine and Shukra Vega, the food like Vishtambi, Ruksham, Guru, such Annapanam has to be avoided. Viruddha Annam has to be avoided. These are the apatya in the treatment of Ashmari. There are many formulations in Ayurveda Shala which indicates Ashmari as one of the Roga, like Kumarya Savam, Chaviga Savam, Dashamula Ashtam, Pudi Karanja Savam, Johida Karishtam. All these Arishtams have indication in Ashmari. And Dhanandram Tailam, Chirya Narayana Tailam, Padola Muladi Kashayam, Veeradaradi Kashayam, Saptasaran Kashayam, Brihatyadi Kashayam. There are many Kashayams in which Ashmari is indicated. And Hingwadi Guliga, Chandraprabha Vadiga, lot of Gridam preparations like Amrita Prasha Gridam, Charngeryadi Gridam, Trigandagadi Gridam, Trigandaga Gridam, Vastyamenda Gridam, Varnadi Gridam, Shadavityadi Gridam, Sarvayamenda Gridam. All these in the slogas, in the Palasruti, Ashmari is indicated. I mean, in the Churnams, if you go to the Churnam and Ksharam and Basmam, Hingojadi Churnam, Kalyanaksharam, Kshara Agadam, Yashada Basma, Vanga Basma, all these having role in treating Ashmari. And in the Leham section, Chavana Prasham, Dashmola Hariati, Narayana Gulam, Shadavari Gulam. See, there are a lot of formulations in Ayurveda Chala in which Ashmari can be treated. The choice is ours, the doctors, in which yoga we have to select. So, these are the basic principles of treating Ashmaris. And when we go to the practice, I would like to share my experience in treating renal calculi with a particular set of medicines. During our practice, we use many types of medicines. But in this condition, I have selected in this presentation, I have selected a particular set of medicine, like a case series, in which very good results are seen. I want to share the failed case. So that doesn't mean that I am always in a winning position, or sometimes we fail also. I want to share the failed cases also. So this is case one, 30-year-old, complaints of dysuria, low back pain, lower abdominal pain. She is a diagnosed case of renal calculi. Investigation shows calculi of 5 mm in left kidney. Why I have selected these cases? This is my first ever cases in which I have treated independently after the house urgency, after starting the independent practice. This is my first case in which I have treated Ashmari independently. That's why I have selected this. The size of the calculi is 5 mm. So at that time, I thought it is very, very big. Actually, it is not. We will say in later. So the investigation showed, it's in the left kidney. So medicines given is Veeradaradi Kashayam, 15 ml twice daily before food, Chandanasavam 30 ml before BD after food, and Kalyanaksara quarter teaspoon at bedtime. Advised to take plenty of water. Medicines are continued for 3 months. The symptoms reduced within a few days, and the new ultrasound after the 3 months, it's quite normal. First thing I have to explain is that it is my first ever case. 23 years back. So I was afraid of going for a new ultrasound, new test. I don't know when to do the next ultrasound. So I have waited for 3 months, and then I advised for the new test, and it was normal. Then by treating such cases, I am in confident that how to test further, when to do the further test, I have changed my mind. Then we can see next cases. This is case 2, case number 2. It's a 29 male. Symptoms are severe lower abdominal pain, low back pain, dysuria, and it's a diagnosed case of renal stone. It is, this case happened, after starting 15-20 years back. It is start, this cases appeared. In between, I have a lot of experience in treating renal calculi, by which I have advised many, I have changed my so many medicines, but for this presentation, I have said the same combination. This is the ultrasound in 2008. Right, there are 2 renal calculi in right kidney. It is 21.2 mm, and second one is 8 mm, and he has grade 2 hydronephrosis, right? Because why I have selected this case is this is the largest stone, urinary stone I have ever treated. The first case is the first ever case, and this is the largest stone I have treated successfully. So 21.2 mm is, actually it is a very large stone, and because of the obstruction, he has grade 2 hydronephrosis. It shows that he has a obstruction in the ureter. I have given the same set of medicines like Veeradaradi Kashayam, Chandanasavam, and Kalyanaksara. This is the particular combination I would like to share in this presentation. Course of the treatment: abdominal colic reduced within 3 days. He had a very severe pain, but it came down within 3 days. Hence, I have stopped the Chandanasavam. Other medicines like Veeradaradi Kashayam and Kalyanaksara has been prescribed. I have asked the patient to go for the ultrasound after 1 month. So nowadays, I ask the patient to go for new test after after 1 month, because we have to know whether our medicines are responding or not, and is there any complication, or because the patient is having hydronephrosis, whether it is worsening or not, we have to understand. That's why I have asked the patient to go for the further test. Within exactly after 1 month, the calculi of size 21.2 have reduced to 16.5, and the calculi of size 8 mm has gone. The hydronephrosis has reduced to grade 1. So there is a great difference in the size of the urine, the urinary calculi, and the symptoms, as well as in the case of hydronephrosis also. But unfortunately, I have lost my follow-up of the patient. So this is the third case in which I would like to share an adverse event. The patient is 45-year-old male. Symptoms are dysuria, lower abdominal pain. Actually, he doesn't have any much severe symptoms. He's having pain, that's all, and some pain while passing urine, and he is also a diagnosed case of renal calculi, and there are two renal calculi of sizes 7 mm and 5 mm given the same set of medicine. Actually, when we compare the size of the calculi with the previous case, it is much less. Actually, it is not a bigger one, but I have shared this case because to show the adverse event, what happens sometimes. The symptoms are less, the size of the kidney is less. So I was much confident in treating this case, and I have given the same set of medicines also. So, and during the course of treatment, he had developed a severe dysuria, Jwalan actually, burning sensation followed by hematuria after a week. So he was not much, he don't have any much symptoms earlier, but he developed dysuria and hematuria after a week, and he has passed a stone through the urethra on same night. The symptom has changed to hematuria. He had a lot of bleeding as that, and had to get treated with modern medicine for the residual problems. Residual problems, the dysuria as well as hematuria. Actually, in the follow-up ultrasound shows both the calculi had gone. Actually, it's a success story because what we have intended to treat, Ashmari, it has gone, but he had suffered.
So चेहरा पे स्टॉप करके रखो.
Hello.
हम भी कर. हेलो. अच्छा अपन भी कर सकते.
Developed hematuria, and it is my first case in which I have faced adverse events. So in the treatment of Ashmari, we have to expect such adverse events. So in this case, I have advice for the modern medicine, referred to modern medicine, and but by that time, both the calculi had gone. And I would like to share one of my failure case also. It's a 5-year-old child. The patient is asymptomatic. It's a diagnosed case of recurrent renal calculi. He had undergone many times the surgical manuals, lot of surgical manuals, and given the same medicines, but I couldn't succeed in repeated investigation. I don't know why it is happening. Sometimes the patient is only 5-year-old. Getting calculus in 5-year-old is rare, though it happens. And maybe there is some genetic predisposition. The medicine may be a wrong thing. Sometimes I have to change the medicine, but I couldn't, and the parents also are not satisfied with the treatment. They have changed the treatment. So why I have selected this case is to show that sometimes failure also occurs, and sometimes this is the youngest person I have treated in urinary calculi. So just to show that sometimes failure, adverse event, success, everything is mixed. Everything happens, but most of the time it is in the success side. So when we go for the discussion part, what is the aim of treatment in Ashmari Chikitsa? First thing is to relieve the symptoms. Second thing is to cure. And I have mentioned in my earlier that when to do the further test. That is always as a doctor we always face when to do next. So my opinion is it is to do every month after 30 days. If we can see the upasham, then we can continue. Sometimes there will not be any improvement, so that we have to think about another treatment, whether we have to refer back to modern medicine or not, that we have to think about. So we have to do the tests like ultrasound frequently every month. And how long do we have to continue the treatment? Usually I treat them, after getting out of all the calculi, I would like to advise the patient to continue the medicines for 1 or 2 months. In my experience, the size of the stone doesn't matter. Actually, whether it is very big or small, it doesn't matter. The position of the or other complication of the patient matters. There are many instances in which we treat very large stone successfully. Sometimes a small stone can create complications. And another thing is how many medicines has to be given at a time. So usually I restrict to 2 or 3 medicines. Nowadays I restrict to 1 or 2 medicines. That I will discuss it later. I have mentioned that all Ashmari are generally Shleshmacha. Sanjayade Ashmari Gora Pitavara Shleshmasya Sarvahasya. So there is a role of Kapaharatvam in all Ashmari Chikitsa. So the justification why I have selected Veeradradi Kashayam, Chandranasam, Kalyanaksara, everything that I will explain you. Veeradradi Kashayam is nothing but the Veeradradi Ganam mentioned in Ashtangaryan Sutrasthanam. So in Veeradradi Kashayam, Ashmari is indicated. That's why I have selected this Kashayam. Many times in Ashtangaryan Chikitsa, Veeradradi Kashayam or Veeradradi Gana is mentioned in many times, like Kashayam, Veeradradi, Khridam, everything is the Kashayam or Khridam made of Veeradradi Ganam can be incorporated in the treatment of Ashmari Chikitsa. That is why I have selected Veeradradi Kashayam. In my experience also, though there are many other Kashayams, I found it very useful in treating Ashmari, like Veeradradi Kashayam. And second one is Chandanasavam. Renal calculi. Most of the time, the renal colic is caused by the sometimes it may be due to the position of the calculi, or sometimes it may be due to the acidic nature of the urine. So the acidic nature of the urine can be reduced with the Chandanasavam. In my experience, you can try it in your clinical practice. Chandanasavam is very effective in mild to moderate renal colic. If the patient can bear the pain for 1 or 2 days, definitely Chandanasavam will help you in treating. Because another interesting point is that sandal oil were given in medical colleges in 1950s or 60s for the treatment of renal colic. So Chandanam, Chandanasavam, Chandana Thailam, all these having a very good role in treating Ashmari symptoms. So though the pain is the main symptom in treating, in the case of Ashmari, so Chandanasavam will definitely reduce the pain. You can try it in your clinical practice. There are a lot of, I have mentioned initially that there are lot of arishtams mentioned in the Ayurveda Shala formulations. I select Chandanasavam because I found it very useful in reducing the renal colic. And the Kalyanaksara, the Ksharam. There are 2 types of Ksharam, Paniya Ksharam, that you know, Pradisarniya Ksharam. So the intake of Paniya Ksharam is, the indications are, Ashmari is one of the disease mentioned in Paniya Ksharam. So Ashmari is in Ashmari, intake of Ksharam can be incorporated. And Kshara is very important in Ashmari Chikitsa. There are many instances in which Ksharam is mentioned in Ashmari Chikitsa. Kavaje Vamanam Svegam Pishnashna Kadubrojanam Yavanam Vigriti Ksharam Kalashayam Cha Shilayada Kshara Kshira Yavad Bhoti Drivyahi Soisha Kalpe. So there is a definite importance of Kshara in treating Ashmari. So there are two types of Kshara, Paniya Kshara and Pradisarniya Kshara. Paniya Kshara is internal medication with of Ksharam. So Ashmari is indicated. So in that way also Paniya Ksharam can be in intake of internal usage of Kshara is indicated. And Ashmari Chikitsa in particular, Kshara is in many instances Kshara is mentioned. So I have selected Kalyanaksara because Kalyanaksara is indicated in Ashmari. This is Ashtanga Hridayam Chikitsa, Arsho Chikitsa. If you go to the last line, Sapeda Sarpishan Yukto Bhaktova Snigdha Bhojana. Actually, Kalyanaksharam has to be taken along with a sneham, like ghee or taila, something along with that. Sapeda Sarpisha. Most of the time we use Sugumara Gridam or Sarvamyanda Gridam along with Kalyanaksharam in treatment. But the above mentioned 4 cases, I have not given Kalyanaksharam. I have just given the Kalyanaksharam. I have not given the Gridams. I have given only Kalyanaksharam with warm water. So it can also be given as mixed with warm water, not with Sarpisha. But in yoga, it is indicated is Sapeda Sarpisha. So along with Ghritam, you have to, maybe it reduces the Tikshnada of the Ksharam. I don't know. The problem with the Kalyanaksharam is that if we take Kalyanaksharam with warm water, it gives some peeling of skin in the mouth. There may be some mouth ulcerations, and it is like sand in the mouth, and some patients like it's very sore to take. Some difficulty in taking. There is some difficulty in taking Kalyanaksharam along with warm water. If we mix with Sarpis or Ghridam, it reduces such complications. And another important thing is that the Kalyanakshara contains Arushkaram. Arushkaram can cause allergic to some persons, like allergic skin rashes, itching, something like cuts and burns, like symptoms may appear. If the patient is allergic to Kalyanaksharam, we have to stop the Kalyanaksharam. We have to educate the patient that if you're facing itching and rashes, you have to stop this Kalyanaksharam. You have to look for other medications. So Kalyanaksharam is in my experience, Kalyanaksharam is very, very effective in treating Ashmari. The thing is that it contains Arushkara, which can cause allergic reactions. So we have to be careful. We have to educate the patient prior to the treatment, first thing. Second thing, if the patient is having mouth ulcers, peeling of skin from the mucosal, peeling off from the mouth, you can use any type of Ghridam. Some of my colleagues use Beladailam along with Kalyanaksharam. Some of them use Sugumara Ghridam. Some of them use Sarvamyanda Ghridam. Anything you can mix with and you can take. So, Sapeda Sarpisha Yuktam Bhavetva Snigdha Bhojana. This is the indication, this is the sloga of Kalyanaksharam. So, Ashmari is indicated. It contains Arushkaram. It has to be given along with ghee, but in my experience, I usually give it with warm water, and it gives good result also. Nowadays, after treating, my experience is like around more than 20 years. So I started giving, in certain cases, I give Kalyanaksharam alone in treating Ashmari. If I don't give Viradharadi Kashayam or Chandanasan nowadays, only give Kalyanaksharam, and it also gives very good result. So that's why in the discussion part I have mentioned that how many numbers of medicines you give. Usually 2 to 3 medicines. Nowadays it's 1 to 2 medicine. It depends according to the confidence of the doctor whether how many medicines has to be added or not. Nowadays, I mean, Kalyanaksharam alone also gives very good result. And the dose of the Kalyanaksharam, it is, say, in the textual part, there may be some milligram, 500 milligram, 215. There will be some difference of opinions. In our practice, I started my career with 1 gram once a day. Nowadays, I give 2 grams, 2.5 grams, 2 times a day. It doesn't cause any problem. Higher dose of Kalyanaksharam can give very good result in treating Ashmari. So these are the my experience in that I would like to share you. So if you have any doubt, you can ask. Otherwise, you can please note my email ID. You can ask in my email so that I happily reply you everyone. Thanks a lot. Thanks a lot. And thank you, Mumbai branch.
Sir, what is the treatment of recurrent stones? Recurrent stones.
Dear, 1 second, doctor. Dear doctors, before we start with the question and answers, Ayurveda has been conducting the continuing medical education to reach the maximum Ayurvedic physicians. And this is also to let you know that we are providing quality medicines and sending medicines from branch and through dealer network. You may kindly contact Mr. Vinayak Amte, Marketing Executive, Bombay branch. We can start with the question and answer section, please. Dear doctors, you can start your question and answers, questions to the doctor.
Sir, treatment of recurrent stones, recurrent again and again, one after 1 year.
Yeah, thanks a lot, sir. Same treatment can be given, same set of medicines can be given, but the duration of the treatment can be increased. And if once we remove the stone, then we can go for some snehana, ghrita type of preparations. First of all, we can treat with the like Viradharadi Kashayam, Kalyanaksara, etc., and go for the repeated test. Once the stone comes out, you can use Gridam to stop further recurrence. But sometimes it may recur. If the stone happens, there may be some gap in between formation of the stones. So in between, we can use the Gridams. And if again the stone happens, we can start with Ksharam and Viradharadi Kashayam. It's a longer duration. I have told you that in the treatment of Ashmari, after passing the stoning, after relieving the stone, I usually give the medicine for 1 more month. In recurrent stone, in the case of recurrent stone, we have to give the medicine for a longer time, some 3 months, 6 months, even 1 year, we have to give the medication. I don't know whether Vasti can be given in that cases, because in textbook says that Vasti can be incorporated in the treatment, but I have never done that Vasti in treatment of Ashmari. That we have to think about that also. But the thing is that we have to do the repeated investigations, and we have to give the medicines for a long time. And repeated recurrent stone may be having a problem with a genetic problem. In such cases, I have mentioned in my case, in 5-year-old child, it was a failure. It's a recurrent stone. What the child is doing, that the parents is doing, that whenever the stone happens, they go to the doctor and try to remove the stone and again wait for next stone to be formed. So it happens. So we have to give, that's why we have to give the medication for a prolonged time. And Gridams can be like Sarvamendra Gridam, Sukumara Gridam, Viradharadi Gridam give results. Thanks for the question, sir.
Sir, what pathya you will advise? Dietary restriction and
See,
all?
usually I have mentioned in my presentation what are the Pathyan, Kulatta, Goduma, everything. But in general, I ask the patient to avoid spicy foods, avoid food that are difficult to digest, and particularly ask the patient to take more water. The hydration of the patient is very important. In modern medicine also, saline is given, even IV fluids are given to produce more urination. So the main aim should be to reduce the load to the alimentary system, to change the acidic nature of the urine by hydration, and the food that are difficult to digest will be advised.
How long Chandanasam can be given? How long?
Chandanasam, actually, it's a symptomatic medicine, though it is Ashmari is indicated in Ashmari. Chandanasam is indicated in Ashmari. I particularly select, and so I am particular about reducing the number of medications to reduce the burden of the patient to by the financial crisis. I usually ask the patient to stop Chandanasam once the pain reduces. Pain and dysuria. What I am looking is that pain as well as dysuria. The dysuria means burning sensation of urine while passing. Burning sensation of urine. Usually it happens. The change can be seen within a week. In some cases, within 2 days we can see the changes. But 1 week you can give, 2 weeks you can give. If the pain comes down or if the jalan comes down, you can stop the Chandanasam and continue with other medication. I again would like to say that Chandanasam reduces renal colic. Renal colic with mild to moderate colic. If the pain is too much severe and nothing can be done, we have to refer them to allopathic side. If he can bear the pain, if it is a mild to moderate pain, definitely Chandanasam gives very good result.
Hello, sir.
Yes, sir.
Sir, one of the patient is there that due to multiple stone, he has developed the CKD for that and creatinine level is high. Yeah.
See, that
What
is
we should do?
that is one of the problem with the cases I have mentioned. All these are without any complications. It's an uncomplicated case. If we treat a patient, Ashmari patient with diabetes, we cannot give Chandanasam. So our crisis starts.
Yeah.
So if the patient is having CKD, we can give Veeradaradi Kashayam. It is very good. It's indicated in CKD also. We have experience in treating CKD with Veeradaradi Kashayam. So Veeradaradi Kashayam can be given. And if the patient is having diabetes, we cannot give Arishtams. And Kalyanaksara in low doses can be given, because we have to take care of the CKD also. In such cases, our responsibility increases with doing the renal profile test very, very frequently. Do no harm. That should be our motto. We have to treat the cases, but we should not harm the patient also. That's how we can do that with the repeated investigations. Make sure that the patient is okay. So Veeradaradi Kashayam, Kalyanaksara can be given. Punarnavadi Kashayam also is good. And another yogam is of Ayurveda, Brihatyadi Kashayam also can be given in such cases of CKD along with Ashmari.
Can chronic history of stones can lead
Pardon?
to strict?
Pardon? Can you repeat?
Chronic history of stones can lead to stricture, sir.
Sometimes the position of the stone can create complications, and the movement of the stone within the kidney and within the urinary system can cause wound, ulcers in the tract, which can lead to stricture. I mean, the formation of cicatrix can lead to stricture. It happens. In stricture cases also, we have to look for the options of snehanam, like Veeradradigritam, Sugumaragritam, Vastyamyantagritam. That type of gritam application, intake of gritam can be beneficial in treating strictures also. But it's we have to do the, we should be very careful. That's all. We can use the same set of medications, and along with we can give the gritam. There are a lot of gritams I have mentioned in my presentation. You have to you can select one of any of the gritams along with.
Good evening, sir.
Good evening.
Hematuria with modern medicines.
Pardon?
How to treat hematuria? Like
Hematuria. So the first thing, what may be the cause of the hematuria? That is the main thing. If we are talking about the hematuria along with, associated with Ashmari, it's actually a simple thing, because we know the nidana, why it has happened, because the movement of, once we give the medicine, the size of the stone reduces, so the stone gets some space in between and it starts moving through the tract, and the most of the time the periphery of the stone will be very rough, and it creates some ulcers in the tract and it causes the hematuria. So the treatment of hematuria associated with Ashmari will be the same treatment. You can give the same treatment, whatever you have selected in the initial symptoms for the renal calculi can be continued. First thing. And second thing, if we want to, if the hematuria is too much, if it doesn't stop after a day or it recurs, we can select medicines like Raktapitta type of medicines we can select, like Pravala Bhasmam can be given along with the medicines which are given. Second thing, Shadavari Adigridam can be given. Vrishagridam can be given. If the hematuria continues, we can give Chandano Shiradi Kashayam. All these medicines are available in Ayurveda. So, if the hematuria is mild and limits itself, we just continue the medications which we give initially for the Ashmari. If the hematuria is too much and if the hematuria continues, then you can incorporate medications which are used for the treatment of Raktapitta, like Chandana Shiradi Kashayam is very, very, very effective in treating hematuria cases. Second thing, Pravala Bhasmam can be given. It's a Stambhana, Rakta Stambhana, we can give Pravala Bhasmam. Third one, Shadavari Gridam, it's in the Gridam form. Fourth one, Shadavari Gulam can be given. And a particular medicine called Pushagridam is particularly integrated. It contains Vasha only. Vrisha Sadhyo Jayati Asram Sahi Asya Paramosham. So all type of bleeding disorders, Vrisha, Arthoda Vasika is the best medicine. So medicine which, Gridam which is made of Vasha, Vrishagridam is a very good choice of treating hematuria. Another point is that if the hematuria happens of something other than Ashmari, that we have to take care of, we have to go for the further incision. What I am saying is that the hematuria related to Ashmari only. I am limiting that.
Sir, can these strictures be completely treated by oral medications?
See, it depends. If we give Gridam for a long time, there are many cases in which stricture has gone. But in some cases, we have to go for the surgical or allopathic maneuvers. That we have to understand the limitations of Ayurveda also. Allopathic medications also have some limitations, because we cannot predict what will be the prognosis of a stricture case. We have to give the medicines and do the repeated investigation. Then only we can say that whether it has gone or not. Sometimes it recurs. It repeats or it continues. In such cases, we have to go for the surgical manuals also.
Sir, please again tell
Sir,
us.
what about severe vomiting associated with renal colic? Which medicine have you found effective for severe vomiting?
The question is that vomiting along with stone, isn't it?
Renal colic, yes.
Yes. See, most of the time the patient may having stomach complaints. The characteristic pain, groin to loin or loin to groin, hematuria or dysuria, these are the classic symptoms of the renal stone. But most of the time the patient may show having the symptoms of stomach complaints, severe stomach pain, vomiting, such things happen. We can give, if once we diagnose the case is a Ashmari case, we can give these medications along with, we can give the Dhanandaram Kuliga or Mahadhanandaram Kuliga. Even Hingojadi Churnam has very good role in treating in these abdominal symptoms. So my choice is that Dhanandaram Kuliga and Hingojadi Kuliga both are available in Ayurveda, but we have to very careful that severe vomiting can cause dehydration, which again increases the acidic nature of the urine and it increases the renal colic. So the hydration of the patient is very important in such cases.
Thank you.
Yeah.
Sir, what is the, please tell us the dose again of Kalyanaksara and duration.
I didn't get it. Someone is speaking in between. Can you please repeat the question?
Sir, what is the dose and duration? Please tell us again of Kalyanaksara.
Yes. See, in textbooks, the dosage of Shara will be much smaller, but in our experience, we give Kalyanaksara 1 gram 2 times a day, or even sometimes we give 2 grams. You can give. So, how long we have to give? See, Shara is not supposed to be given for a quite long term, but we can give 1 or 2 months. So anyway, we have to go for the further checkup after 1 month. Whether to continue the Kalyanaksara, that has to be decided after seeing the report. If the most of the time, if the stone size is less than 7 or 8 mm, the stone will go within 1 month. If the stone still stays in the kidney or in the ureter or the bladder, we can give the Kalyanaksara. We can easily give to 2 to 3 months.
Sir,
I am not hearing, sir. Can you repeat?
What's the treatment in renal calculi with creatinine?
I am not hearing from you.
Excuse me, sir.
How much role location of the renal calculi plays a role in planning the treatment?
Can you repeat? Voice is.
I mean to say how much the location of the stone relates with
yes.
planning the treatment.
Say the one word in Sanskrit in avagasham, the space of the location is very important. If the stone is in pelvis, sometimes it doesn't cause any. For an example, for an experiment, there are many doctors. There are 247 doctors in this session. Just go for the ultrasound, abdominal ultrasound. We will be surprised that many of us having renal calculi without any our knowledge. So most of the time the stone will be in silent or in sleeping. So most of the time they will be in pelvis. The most dreaded position is the ureter. It causes a lot of hematuria as well as pain. So if the stone is in pelvis or in the bladder, it's okay. If it is in the ureter, it can create a lot of symptoms. It doesn't mean that the severity, the symptom will be severe.
Sir, औषध सेवन काल in Ashmari.
See, there are a lot of things we can that has been explained in our text. कब खाना है, कब पिया देना है, बस. लेकिन for our practical, there are two types of approach, like principles and practice. Whatever we have studied in our textbooks, it's a principle, it's a guidelines. But a principle से थोड़ा अलग है practice. Practice में थोड़ा थोड़ा हमारा convenience और हमारा experience काम करता है. So in our practice, we change certain medications, and according to the modern lifestyle, we have to change the dosage and the timing of the medicines. It is not actually it is not against the theory. It is the practice. So if you go for the Davidson allopathy book or Harrison's, there also we can see principles and practice of medicine. इसमें क्या होता है, principles अलग होता है, practice अलग होता है, लेकिन फिर भी इसमें थोड़ा relation होता है. So principles, there may be certain औषध कालम, but in practice what we give is a kashayam 2 times before food, and arishtams, it causes acidity, so 2 times after food, and it contains alcohol also. We cannot give too much of arishtam at a time, so divided dose में 2 बार देता है खाना खाने के बाद. और कल्याणक्षारम also can be given in divided doses, morning and night after food, क्योंकि थोड़ा रूक्ष होता है क्षार, so इसमें it's better to give after food. So these are the indication of medicines, औषध काल.
सर आपका, हाँ सर, आपका एक्सपीरियंस प्राक भक्त और अधोभक्त स्नेहपान और किडनी स्टोन में आपका एक्सपीरियंस बताएंगे क्या?
See, I have not done snehapana in इतना ज्यादा घृत में नहीं दिया है like स्नेहपान की तरह, लेकिन usually I give after food. Ghrita I give, ghee type of preparation I give after food, sometimes at bedtime. So not given in the Prag Bhakta, I have given Adho Bhakta.
Yes, sir. Hello?
Yes, yes.
Can you hear, sir?
Yes, yes, yeah.
Can we add some sugar या कुछ और in also? And second question is, sir, कि क्षार अभी in burning sensation, can we use क्षार preparation?
First question, sugar डालता है क्या बताया आपने?
Yes, sir.
Okay. Actually चंदनासव में शुगर है, तो इसमें मीठा है, तो पीने के लिए थोड़ा तकलीफ नहीं होगा. लेकिन वीरद्रादि कषायम is definitely a काढ़ा है, difficult to take. You can add sharkara, jaggery in वीरद्रादि कषाय. In chandanasam there is no need of adding sugar in the arishtams. And Kalyanaksara in burning, definitely Kalyanaksara reduces dysuria, jalan कम करता है.
Okay, thank you, sir.
Yeah.
हेलो सर.
Yes.
हेलो सर.
Yes, sir.
क्षार का जो डोज बताया है 1 ग्राम या 2 ग्राम, वो पूरे दिन के लिए है या डिवाइडेड डोज, मतलब मॉर्निंग?
नहीं, एक टाइम 1 gram 2 times a day.
2 times. Okay.
Yeah.
Okay. Thank you.
Yeah.
Hello, namaste, sir.
Namaste.
Sir, do we use the basmas with that kshara, sir?
See, sometimes it's associated complaints. If the patient is having acidity, definitely we can give Shangabasmam. If the patient is having hematuria, we can give Pravala Basmam to control the symptoms, not for the main treatment purpose.
Okay. Thank you, sir.
सर किडनी के मैटर में अगर स्टोन है तो यूरेटर में नहीं है, पेल्विस में नहीं है, तो किडनी के मैटर में है, तो उसका एक्सपीरियंस कुछ है क्या आपका, तो वो थोड़ा शेयर करिए.
सेम मेडिसिन इसमें काम करता है. कहीं भी किडनी में, कहीं भी यूरेटर में भी या ब्लैडर में भी, यूरेथ्रा में कहीं भी आप ये मेडिसिन देके दिए. I mean, I'm not saying that only these medicines. Any medicines which are indicated, you can definitely with confidence you give. तो इसमें आपको फल मिलेगा. लेकिन only one thing, you do further test after a month. एक किडनी की I mean स्टोन की साइज कम होता है नहीं, वो आपको देखना है. बिना देखे आप नहीं दीजिए. Every month you can go for, every 20 days you can go for the test. If you have a doubt, आप संदेह है कि वो किडनी स्टोन कहाँ गया, कितना गया, definitely do. There is no harm. Do the ultrasound after 21 days. 3 हफ्ते के बाद आप देखिए.
Okay, sir. Thank you.
Hello, sir.
Yes.
Sir. Hello.
बताइए.
सर कह रहा था वो हिमैचुरिया के लिए आपने कौन सा वृषकघृतम की कौन सा बोला?
वृषघृत ये आयुर्वेद में है.
क्या नाम सर?
वृषघृतम. Yes.
वासाघृत.
Yes, आयुर्वेद में it's called वृषघृतम.
Okay sir, thank you.
Okay.
सर चंद्रप्रभा का आपका एक्सपीरियंस है क्या? महाराष्ट्र में चंद्रप्रभा बहुत यूज करते हैं, तो चंद्रप्रभा वोटी का आपका एक्सपीरियंस क्या है?
A very good question. Usually I use, I mean चंद्रप्रभा बहुत कम यूज करता है अश्मरी में actually. So लेकिन डिस्यूरिया जलन कम करने के पेशाब में जलन कम करने के लिए चंद्रप्रभा अच्छा होता है. एंड इफ द पेशेंट इज डायबिटिक है तो इसमें भी चंद्रप्रभा यूज कर सकते हैं, लेकिन वो चंद्रप्रभा में ज्यादा नहीं देता है अश्मरी में. लेकिन जलन और डायबिटिक पेशेंट्स में यूजफुल है.
Good evening, sir. Sir, how to treat calcium deficiency in recurrent calculus cases, sir?
See, we have to go for the good dietary habits and give the proper. I mean, आपका वो I mean, improve the digestive system so that whatever you eat, it should be absorbed properly. So in such cases, we have to improve the pajana shakti, pajana agni, pajaga agni, like hingojadi churna. That is the role of hingojadi churnam or hingojadi gulika. It improves a lot. I mean, it improves the absorption power of the body. So the calcium deficiency can be corrected up to a certain point, because we cannot give calcium as such for a quite long term. थोड़ा मैं शंकरभस्म प्रोडक्ट्स में आपको दे सकता है, लेकिन थोड़ा टाइम के लिए. I mean, if the patient is having severe calcium deficiency, we have to improve your stomach, digestive capacity, so that the body itself can absorb whatever you eat. इसके लिए अभ्यारिष्टा like arishtams are also useful. Abhyarishtam, mustaristam, such Pudikaranjasam I have mentioned in my presentation. Pudikaranjasam is helpful to improve the digestive power.
सर गॉलस्टोन के बारे में कुछ बताएंगे? गॉलस्टोन के लिए
पित्ताश्मरी के लिए मेरा अनुभव बहुत कम है. इसमें बहुत डिफिकल्ट है ट्रीटमेंट करने के लिए. मोस्ट ऑफ द टाइम लाइक अश्मरी, I mean यूरिनरी स्टोन, पित्ताश्मरी ऑलवेज स्लीपिंग होता है, सोता है. इसमें थोड़ा प्रॉब्लम नहीं होता है. फिर भी कभी कभी होता है कि माय aim of treatment, I mean protocol of treating पित्ताश्मरी is like to improve the digestive power. इसमें आपको क्षार की तरह आपको हिंगोजादी चूर्ण भी अच्छा होता है. फिर भी success rate बहुत कम होता है. I mean, if the patient is having too much of pain, nothing we can do, just refer them to allopathic hospital. It's a surgical.
Sir, Vataj, Pittaj and Kapas, their types they are given. Does the treatment have any effect on that?
No, sir. I have not gone for the वादा पित्ता कापा. I mean, it's a very good question. आपने पूछा, अच्छा क्वेश्चन पूछा है. लेकिन मेरे एक्सपीरियंस में वादा पित्ता कापा अश्मरी के बारे में मैं नहीं देखा है. और दूसरा है कि वेदर है कार्बोनेट है ऑक्सलेट है, वो भी मैं देखा है. अश्मरी है तो आप ऐसा आप इलाज कीजिए, इसमें आपको फर्क मिलेगा. ये मैं बताता हूँ आपको. I mean, definitely we can work on it and you have to do that. It's हर एक डॉक्टर का काम है कि ड्यूटी है कि ये वादिका अश्मरी में क्या देना है, पित्त अश्मरी में क्या देना है. लेकिन मोस्ट ऑफ द टाइम if the medicine is potent enough, you can treat any type of, because in the principles it is said that all the Ashmaris are Shleshmashraya. You can treat like that also. So no need of whether it is Vadiga Ashmari, Pitta Ashmari, Kapha Ashmari की जरूरत नहीं है. आपको फल मिलना चाहिए, वो मिलता है भी रहता है.
Thank you, sir. स्टैग हॉर्न कैलकुलस में सभी बोलते हैं कि नहीं डायरेक्ट ऑपरेटिव के लिए जाना पड़ेगा, इसमें कुछ हो नहीं सकता. तो स्टैग हॉर्न कैलकुलस का कुछ एक्सपीरियंस है क्या?
एक्चुअली इनके मेरा एक्सपीरियंस नहीं है सर. सो व्हाट आई हैव स्टडीड, मैं जो कुछ मैं पढ़ा है कि आपको ये सर्जिकल मैन्यूअर करना पड़ेगा. सो आप एलोपैथिक हॉस्पिटल में रेफर करना अच्छा होगा.
हेलो.
यस
सर, गुड इवनिंग.
गुड इवनिंग
सर, अश्मरी में मात्रा बस्ती का रोल है क्या?
मैं अभी तक नहीं किया है मात्रा अश्मरी, क्योंकि व्हाट एवर अश्मरी का इलाज में हमारा कर्तव्य है कि वो क्योर करना है, पत्थर को निकालना है. दवा से भी आपको पत्थर निकल सकता है, तो मात्रा बस्ती की जरूरत नहीं है ना.
सर, जलन वगैरह जैसे
लेकिन रेकरेंट अश्मरी में रेकरेंट पत्थर में स्नेहना बस्ती वगैरह की रोल होता है. अब मैं कभी नहीं I have not done so far. We can try that also. It's good. स्नेहना की पर्पस के लिए मात्रा बस्ती भी दे सकता है.
सर, स्लाइडिंग मूवमेंट के लिए पथरी इरोटर वगैरह में है तो
पढ़ा?
स्लाइडिंग मूवमेंट जैसे वहाँ पे इरोटर उसकी ल्यूमन में लुब्रिकेशन के लिए
दे सकता है. हमारा घृत देना भी अच्छा होता है. शतावरी घृत
औपीडक स्नेहपान
दे सकता है. आप देख सकता है. लाइक सुकुमार घृतम इज वेरी गुड. आपको उसके साथ आप दे सकता है. सुकुमार घृतम. देयर इज अ मेडिसिन कॉल्ड वस्त्यामयंत घृतम इन आयुर्वेद, so that can also be given. वस्त्यामयंत घृतम.
थैंक यू सर.
सर, ये कैल्शियम का स्टोन है या मैग्नीशियम का? ऐसे कुछ डायग्नोसिस के लिए कुछ अलग टेस्ट आया है क्या आजकल मार्केट में?
आज में मार्केट में आया है. आप लैब से पूछिए. मैंने टेस्टिंग नहीं किया है. जो कुछ पत्थर बाहर आता है, कई बार मैंने पत्थर बाहर आया है, लेकिन मैं टेस्ट नहीं किया. सुविधा है.
Hello.
Yes.
Good evening, sir.
Good evening.
What treatment can be given when patient is pregnant?
Complication. So you can give the kashayam. Veerataradi kashayam can be given in pregnancy stage also. Don't give ksharam. Small dose of arishta can be also given. So Veerataradi kashayam or Brihatyadi kashayam is my choice. हमारा आयुर्वेदिक शाला में बृहत्यादि कषाय में you can give बृहत्यादि कषाय.
Hello, sir.
Yes.
I want to share my experience.
Thank you very much, sir.
Yeah.
Hello.
Yes, sir.
Hello. Am I audible? I'm Dr. Abhishek speaking from Aurangabad,
Yes,
Maharashtra.
Yes.
I just want to share my experience in pregnancy patient.
Okay.
I had a case of urinary calculi in pregnancy. So I just given Avapedic Snehan like before and after, and only I have used Gokshura and Vada Churna, Ushira. Ushira and Gokshura. Ushira and Gokshura Churna along with ghee, along with Grita. I have given for 1 month. After 1 month, USG has been done. In that ultrasound, the calculi was that means the report was normal. So
very good. Good experience, sir. Good experience.
Yeah, with Grita and Avapedic Sneha I have only.
Which grit you have given?
Plain Grita, ma'am. Plain. I asked patient to which home prepared grit only along with Kokshura and Ushira Churna.
Okay, thank you.
So what is the dose of Ushira and this thing, Vada and this thing, Kokshur?
1 teaspoon, sir, along with the gruta, 15 to 20 ml gruta, 1 teaspoon of both.
Once a day or twice a
Then
day?
twice avpidak before food, 1 hour before food and 3 hours after food, lunch time.
Okay,
not
thanks,
dinner.
sir, very much. Thank you, sir, very much for sharing this.
Okay. Thank you, sir. Thanks a lot.
Okay.
Hello, sir. Can you ask?
Yes, yes.
Sir, Chikitsa, please.
Not hearing questions.
जिसको recurrent
Not hearing properly, sir. मैं नहीं सुन पा रहा.
recurrent renal calculation हो रहा है वो पुनर्भव चिकित्सा.
Recurrent renal calculi?
Right, yeah, right, sir.
Yes, yes. See, in recurrent renal calculi, the role of Ghridam is important. You can give Sarvayamendra Ghridam or Sukumara Ghridam that you can give. But it has to be given for a quite long time. And proper correction of the diet and dietary planning has to be corrected.
Okay, thank you, sir.
सर इसमें पैराथायराइड हार्मोन का कुछ रोल आपने देखा है क्या? पैराथायराइड का और कैल्शियम या कैल्कुलस
Theoretically, there is relation, but मैं नहीं देखा है.
Sir, if there is only hypercalcemia, then only you go for the parathyroid hormone test. Otherwise, you don't go.
So, in my experience, I have not gone for the. I mean, इसमें होता है नहीं होता है, फिर भी आप देखिए, आपको वो कैलकुलेट को रिमूव करना जरूरी है ना, इसके लिए ऐसा मेडिसिन यूजफुल होता है.
सर कल्याणाक्षर का रोल, हाउ डू यू एक्सप्लेन सर रोल?
See, it is roga shamana. There are certain medicines which are useful in certain conditions. Kalyanaksara has affinity to remove these type of stones. So, Vyadihara, I mean, we can see Doshahara, Vyadihara. So, Kalyanaksara is Vyadihara in Ashmari Chikitsa.
Thank you, sir. Sir, I had used in acute cases Vayugulika and Viradaso plus Dashmularista. It gives very nice result in severe pain, sir.
Yes, sir. That's what I am saying. There are a lot of medicines.
Sir, please repeat, sir. Please repeat. Please repeat the medicine.
इसमें आयुर्वेद में बहुत सारा, I mean, there are lot of medicines in Ayurveda. आपको इसमें जो कुछ आपको select कर सकते हैं, आपको relief मिलेगा. With confidence, you just give the medicines. You can see the difference. I have just mentioned some of my experience. That's all. With a particular medicines के साथ मेरा experience मैंने share किया. इसका मतलब नहीं है कि सिर्फ ये दवा काम करते नहीं, बहुत सारे अलग दवा है, same result मिलता है. So it's all of the doctors कर्तव्य है कि आप record कीजिए, अच्छा होगा.
Yes, yes. Thank you, sir.
सर रिकरेंट यूटीआई में क्या देते हैं आप? क्योंकि स्टोन नहीं है लेकिन बार बार यूटीआई होता है.
Recurrent UTI is because of the faulty, maybe it may be due to the faulty lifestyle. पानी ठीक तरह से नहीं पीता है, वो धूप में काम करता है, ऐसा होता है. तो hydration is the first principle you have to follow that. Second thing, that if you go for the medicines, you have to Brihatyadi Kashayam is good, Chandranasam is again good, Kumaryasam is good, and इसमें Chandra Prabha is also good. And I mean, if it is a recurrent thing, you give the Ghridams like Vastyamendra Ghridam is my choice.
Pardon?
Kumarya Gurukla is also useful.
Sarvamendra Ghridam.
Okay. Thank you, sir.
Yeah. Sir, Sukumarya Ghrutta is also useful in recurrent UTIs.
Repeat कीजिए.
Sukumarya di Ghrutta.
Yes, Sukumarya Ghrutta is very much useful.
Yeah.
Yeah, दे सकता है.
Sir, what is the difference between Sukumarya di Ghrutta and Kashayam?
So both same medicines, same yoga है.
Both are same, but
Both are same yoga.
some gastric irritation is happened after Sukumaryadi Kashayam.
Not for everyone.
Okay,
Sometimes
for
hota
Pitta
hai.
Prakriti only means.
Same, maybe, but so usually it is very mild, doesn't cause any stomach irritation. So both are same yoga.
Mm-hmm.
Sir,
Okay,
have
sir,
you
thank
treated? Sir, have you there any cases treating like 10 centimeter renal calculi?
Pardon?
10 centimeter renal calculi treatment, and have you treat the patient like that?
What?
7 to 10 centimeter renal calculi patient.
How much? I mean,
7 to 10 centimeters.
10 centimeters. She's
centimeter, no. 2 centimeter is my largest stone that I mentioned earlier.
Okay. For prophylaxis point of view, what the medicines should we prescribe and what will be the diet plan, sir?
See, the normal diet restriction, like to avoid spicy food and the food which are difficult to digest will be beneficial. Hydration, take more water, and for a prophylactic purpose, Sarvayamendra Gridam, Vastyamendra Gridam, or Sukumara Gridam will be beneficial.
Okay, sir. Sir, what will be the treatment up to 2 centimeter for removal of the stone?
Yeah, that I have mentioned in my presentation. Veeradharadi Kashayam, Chandanasam, Kalyanaksara is, I have experience in treating stone of 2 centimeter, which has been removed with these medications. Kalyanaksara bahut acha hota hai.
Okay, thank you, sir.
Sir, namaskaram. Thank you so much for your informative session.
Yeah,
I had a lot of patients come with Google knowledge. So a lot of people have come on, like, taken this yoga, which is olive oil and soda and lemon juice and little salt. So they say that it will, that comes out, renal calculi comes out, or the pain eases out. So do you have you come across anything like that, or like some anubhutik chikitsa, experienced medicine?
I have not noticed it. इसमें केरल में ऐसा प्रयोग नहीं है, so मैं नहीं देखा है.
And sir, what do you think any role of lepan chikitsa on kidneys outside? like आप अभ्यंतर नहीं कर सकते हैं तब बाह्य चिकित्सा will work?
If the patient is having low back pain and टेस्ट में स्वेदन बताता है, स्वेदन क्रिया, so इसके लिए आपको दानंद्रन तैलम और चर्या नारायण तैलम अप्लाई करके स्वेदन करना अच्छा होता है. so इसके लिए बाह्य प्रयोग भी कर सकता है, लेकिन usually I have not done that. So
okay, and thank you so much, sir.
Okay.
अवगाह चिकित्सा सर आपका एक्सपीरियंस है क्या? कुछ
अवगाह में होता है आपको ये
कब करेंगे?
प्रॉब्लम होता है कि कभी कभी क्या होता है कि यूरिनरी स्टोन में मोशन में भी प्रॉब्लम होता है, संडास में भी प्रॉब्लम होता है कि आपके बार बार जाने के लिए इच्छा होती है लेकिन नहीं जाता है. जलन एनल रीजन में भी होता है कभी कभी, इसके लिए अवगाहन वगैरह अच्छा होता है. गुनगुना पानी में बैठ कर बस.
सर, जिनको रेनल कैलकुला की हिस्ट्री है उन लोगों को कैल्शियम प्रिपरेशन जो एलोपैथी में दिए जाते थे वो प्रिस्क्राइब करने चाहिए या नहीं?
Prolonged usage of calcium supplement will be not advised, लेकिन थोड़ा वो टाइम के लिए दे सकता है. और if you want to take calcium tablet, you take for 1 month, give a gap of 15 days, again restart for 1 month, again ऐसा रोके दे सकता है.
Okay. Sir, the best herbal preparation of calcium is prescribed. Some people like take a raw tuna in the milk or water. Is it correct or not, sir? जैसे बोलते हैं 1 बूंद चूना अगर लेते हैं तो वो 1 टैबलेट का वर्कआउट करता है.
Actually मुझे पता नहीं है अच्छा है नहीं पता नहीं है.
नहीं, I also just heard sir, not experience.
I have not
दूसरी बात
experienced.
ये पूछना सर, वो पर्णपुटी जो है पाषाण का जो बोलते हैं कि 5 या 7 डेज हम लोग अगर कंटिन्यूअसली लेते हैं उसके पत्तों का रस तो स्टोन रिमूव हो जाता है, ऐसा कुछ एक्सपीरियंस
वो भी
है?
नहीं देखा, ऐसा प्रयोग हम नहीं आता है, केरल में नहीं होता यूजुअली.
Okay.
नहीं सुना है.
Namaste, sir.
Namaste.
Yeah, it was a wonderful session, very practical.
Thank you.
Sir, to flush out the stone easily, Usually we advise horse gram water or this maize hair, that golden color hair what we see on the top of the maize, no sir?
Okay.
That we usually ask them to boil and use that water throughout the day for 10 to 15 days. And very easily, yeah, it will help them to flush out the stones.
Without any other medication?
Along with our medication.
Okay.
Help to flush out the stone very easily. These two will help very well.
Say, the basic principles of treating the, I mean, बहुत अच्छा experience आपने बताया है. And the basic principles of treating Ashmari is to hydrate, increase the urination. So आपको वो बृहत्यादि का पानी हम like गोक्षर पानी अब दे सकता है, ऐसा पानी दे सकता है. But we have to coconut water can be given और गुनगुना पानी दे सकता है. लेकिन taking more water is the first line treatment in treating Ashmari.
We have seen very effective with these two.
Yes. And in allopathy also they give IV fluids in treating. Initially they will give IV fluids. अच्छा होता है. अच्छा experience आपने बताया. Thank you.
Thank you so much, sir. Thank you.
Anand.
Hello, sir.
Yes.
Yes, doctor.
आपने बताइए. ആനന്ദ് നിർത്താറായോ? ആയിക്കോട്ടെ. ഇനി ആർക്കെങ്കിലും ഡൗട്ട് ഇല്ലെങ്കിൽ നമുക്ക് വേണമെങ്കിൽ നിർത്താം കേട്ടോ.
हेलो सर. सर मुझे बताना है कि पर्णफुटी जो है ना, मेरे एक पेशेंट है, उनके पास वो झाड़ी है जो जब भी जो स्टोन का तकलीफ होता है ना, उन लोग सुबह उठ के ही पहले वो पत्ता जो है काली मिरी के साथ खा लेते हैं.
वो आपका हिंदी मुझे थोड़ा डिफिकल्ट है. कैन यू से इन इंग्लिश?
या दैट पर्णफुटी लीफ.
ओके.
पर्णफुटी लीफ.
That is
one of my
patient,
patients, she have that plant. Yeah. And whenever there is a stone, they always eat with black pepper early in the morning, empty stomach.
Okay.
And they didn't stop before if stone removed, then they stop only.
Okay. Thank you.
And about the calcium, that one of this friend said that log चूना खाते हैं. तो वो चूना है अभी impure है. अभी का जो चूना मिल रहा है ये प्योर नहीं है.
That is the main problem. Whether can be it's pure or not, that is the main problem.
Yeah, that is the main problem. So people लेते हैं, मैं तो बताती हूँ कि तुमको लेना, तुम्हारा own risk. वो तुम देखो.
Yes.
या उसमें से कितना कैल्शियम मिलता है वो सब झूठ है.
Okay.
Okay, thank you.
Hello, doctors. I hope there are no more questions. So can we wind up the session? Praveen sir?
Yes, നിർത്താം.
നിർത്താല്ലേ sir? ശങ്കറാണ്.
ആയിക്കോട്ടെ ശങ്കർ, നിർത്താം.
So I thank all the doctors for attending this session, and especially I thank Dr. Praveen for such an enlightening session. And for the keen listening of the doctors, I thank them from the bottom of my heart. And thank you all.
Thank
we'll
you,
meet
sir.
again in the
Good
next
day,
session.
sir.
Thank you, sir.
Thank you all.